Why the CDC still denies chronic Lyme disease, the untold story. Hello, I am Dr. K. Paul Stoller, and some of you know I have a detailed webinar on the correct way to treat Lyme disease at KennethStollerMD.com. I'm often asked why the CDC continues to deny the existence of chronic Lyme disease. In 2006, I actually went to the CDC to try to help them understand the problem. Back then, they were only admitting to about 3,000 new cases per year. Today, the real number is approaching 500,000 new cases annually. Why the massive change? Because a new Lyme vaccine is coming. And suddenly, the numbers need to reflect reality for economic reasons. Here's the uncomfortable truth I was told during that visit. Whenever the government plays a role in creating a problem, they will almost always obfuscate it.
Lyme disease is the perfect example. The organism that causes Lyme, Borrelia burgdorferi, had its virulence enhanced in the infamous Lab 257 at the Biowarfare Facility on Plum Island, New York. This is not wild speculation. It's documented history that many prefer to ignore. Lyme becomes chronic because this clever organism forms persister cells, dormant forms that can survive antibiotics and reactivate when conditions are right. The CDC doesn't want to admit this reality. Why? Because if they acknowledge chronic, persistent infection, it would completely destroy their current treatment guidelines, which rely on short courses of antibiotics that make no logical sense in the presence of persister cells. They have nothing effective to offer for chronic cases, so denial becomes the official policy.
Things have only gotten worse. We're now seeing mysterious surges in ticks across multiple states. Reports of GMO ticks being planted in certain areas are increasing. Why? To drive demand for a new Lyme vaccine they desperately want to sell. First, they help create or amplify the problem. Then, they offer the expensive solution, and once again, the numbers are being adjusted upward right as the vaccine approaches approval. I've been treating complex chronic Lyme and tick-borne illness for decades. I've seen what standard guidelines fail to address. That's why I created a webinar on treating Lyme disease at KennethStollerMD.com. We focus on real integrative approaches that actually help patients who have been dismissed or left behind by the conventional system. If you or a loved one is struggling with chronic symptoms after a tick bite, know this: you are not crazy. Your illness is real, and there are better options than what the CDC currently recommends. Comment chronic Lyme below if this resonates with your experience. Share this video with anyone suffering from unexplained fatigue, joint pain, neurological issues, or chronic illness. Subscribe and hit the bell for more uncensored truth on Lyme and tick-borne diseases. We're going to keep speaking the truth until real change happens. Again, my webinar is at KennethStollerMD.com.